And go.
Kemp's test. Kemp's test is you take on the shoulder on the side that you're standing on and the hip right here on this side. You put pressure on the hip on this side. You pull the shoulder back and you ask them if there's any pain. So that's going to be thoracic. I do it again on this side. Is there any pain with that when you're doing that? Okay, now I'm going to ask her to turn and go like this. And what I'm going to do is have the Trendelenburg's test. Just kind of pull your foot up. And what we do is we watch to see if the butt moves too much. That sounds so bad. if we have dropping on this side when she pulls her legs up, or hiking on this side and this side drops, what that shows is going to be some hip problems. Okay, so in your notes it'll tell you that. Okay, now can we just take a break and pull this out again? Okay. Okay. Lassaig's test. I'm going to have you face up on that, baby.
Okay.
Okay. Okay, on Lassaig's test, what we do is we take the leg up and we go 90 degrees. So let me have we go 90 degrees like this, and then we take it straight. What we're doing is we're pulling the sciatic nerve. So remember to take it up 90 degrees and then up straight, okay? And then the next one we're going to do is Braegert's test. And on Braegert's test, what we do is a real fast dorsiflexion. So I'm going to push her foot to her head. So I'm just going to come in and push her foot up to her head like that. That also stretches the nerve. So if you just pull her foot up off the table, or anybody's foot up off the table, a little bit, like 35, 40 degrees, that helps with that. And then there's something called Fitzpatrick's test, or figure 4 test, where I take her leg and we put it over her knee so it looks like a figure 4. On younger people, we can do this. We can take the knee and the hip and kind of push down. Not real hard, but just push down. And on older people, we don't do that because many times they have hip problems. So we're just trying to test the hip. Linder's test, what we want to do with Linder's test to check sciatica again is that we want her to do just kind of a half sit-up. So I'm going to hold her legs and just kind of do a little half sit-up. Yeah, there we go. And I didn't show Soto Halls either. As she's down here, we'll do Soto Halls. Soto Halls is close to this. What I'm going to do is just kind of place my hand right here, and either I can pull her shoulders up and head up, or she can do it herself. So just pull your head up. What I'm doing is I'm just holding her shoulders down slightly to the table so that she doesn't pull them up. So basically what we're doing is stretching the whole cord there. With Soto Hall, that means that there is subluxation. That means there can be spinal meningitis. There means a whole bunch. But with Linder's, what we do is when she pulls up and I'm holding her feet, is going to show that there's sciatic problems. So there's a lot of things that are fun with that. Thomas test. What we want to do is have the patient take the knee and pull it up to their chest. And as they're doing that, we want to make sure this other knee is fairly close to the table. If she was pulling it up like this, we would know that she would have some major psoas or iliopsoas problems. And Gaislin's test, what we're going to do is, let's say she's having a lot of problems on this side. I'm going to have you kind of scooch you off the table. Normally you would stand where the patient was like this so they wouldn't fall, but I would be in the way. And then have them pull this other leg up to their chest. So now they're stretching that whole SI joint apart with the Gaislin's test. So some people can do that. They can drop their leg off and pull up. Some people can't. They've got a lot of problems. Okay. Straight leg raiser, okay, at 30 degrees. So here we come up here. We take them up, hand underneath the knee, one underneath the ankle, about 30 degrees. If she said she had a lot of pain there, we would know it was a bulging disc. At 45, now we've got the sacrum starting to move. If she had pain there, we would think, okay, this is a sacral SI joint problem. And up to 70 degrees, now we start moving the SI joint and the lumbar area, so it would be lumbar problems. And so we can take them up like that. So each one of those is a very important area. Now I'm going to have you turn over on your back. Oh, I forgot I had a dress on too. Now, Eli's test is what we're going to do is I'm going to take this foot to the opposite butt cheek. That's all I can say is, okay, this foot to the opposite butt cheek. Her lumbar start to move, so we know it would be lumbar area. Knockless test to this butt cheek. Now we know it's going to be the sacral area. And what I would do then also is just do a real quick test and pull up like this, and that puts a lot more stress in the SI joint again, and that could mean that she's having SI problems, and that is the Yeoman's test. So we have Eli, Knockless, and Yeoman's that we can do, all for this area right in through here. And Yeoman's femoral stretch, that's what you'll see too. Some of them just call it Yeoman's test. And then since she's laying on her, down on her stomach, I am going to do an Apley's compression and distraction test. So I'm going to come in here, I'm going to check the knee joint, okay? So if I do a compression test, I'm going to stabilize the ankle joint. I'm going to come in here and I'm going to press down on the foot, and then I'm going to turn and turn the toes. But I'm going to try to take the ankle joint out of it, so when we're turning. So if I turn this way, then that means there could be a medial menisci that is in problems. If I turn laterally, it can be a lateral menisci that's in problems. Now I know I have a dress on, so this isn't going to work very good. You usually put your knee in. Right,
I'll go this
here.
way, and then it's the opposite direction you're putting
Usually
your
put your knee back here. What we do is stabilize the ankle joint. I pull up because I want to see if the ligaments on each side, the collateral ligaments, I'm going to pull up, stabilizing the ankle, turn again. When we turn into internally, that's going to be the medial. When we turn externally, that is going to be the lateral, obviously. Those. And then I'm going to have you turn over again so that we can do the drawer sign. And what we're checking on again is that knee. I come in here and I'm going to put her knee up. Let's say she's having trouble with this. I'm going to sit on her foot somewhat. And I am going to take the tibia, plateau right here. I'm going to pull out and I'm going to push in. There shouldn't be a lot of movement in that, because what you're looking at is the anterior and the posterior collateral ligaments pulling in and out.
Okay, I'm just going to stop it and start another one real quick.